Is your healthcare practice in need of a patient screening process upgrade? At its very core, a patient screening process is all about gathering your patient's symptoms before a visit. The old school paper and pen method is still used by many clinics, but in today's ever-changing technological landscape, we have options. If you're ready to upgrade from paper forms to something more reliable and safe, stay tuned. I'm Alex with Jotform, and in today's video, we'll discuss the various types of patient screening methods and how they work. Let's get into it. Patient screening not only provides a healthcare worker with pertinent patient info, but it can actually reduce hospital readmission rates. And whether you're seeing the doctor for a routine checkup or you're experiencing COVID-19 symptoms, your provider will be able to better treat you with your overall medical history in front of them. As mentioned, there are a few different methods your healthcare practice can use when screening your patients. There are paper forms, phone screenings, and electronic check-ins. Paper forms are a tried and true method that allows patients to indicate symptoms and overall health in a variety of ways. Patients could be asked to circle areas on a diagram to indicate where they're feeling pain, check off boxes that list their symptoms, and provide their medical history. And while paper forms are great at allowing patients to describe symptoms in their own words, they can result in errors. Perhaps the patient's handwriting isn't the most legible. Correctly deciphering paper forms can be difficult. You can also utilize phone screenings, especially if you have social distancing top of mind. Your patients can call your office prior to a visit to discuss symptoms and find out if they should make an appointment. However, a potential downside of phone screenings is that it requires staff to find more time in their already busy schedule to assist these screenings. This method is also prone to errors if staff is rushed and mistype information. Lastly, we have electronic check-ins. Your patients can electronically enter their symptoms into tablets mounted in the reception area. This expedites the process of filling out paper forms and then entering them electronically, as this is all done at once. One downside, especially within the parameters of the coronavirus, is the ability to keep these tablets sanitized and safe to use. Some healthcare practices have found that mobile-friendly online forms are the most efficient way to go about patient screening. All patients have to do is click on a link sent via text or email. If they're a new patient, you can send them a first-time patient intake form, or if they're there for a checkup, you can send them a form to update their medical information. You can send these forms prior to their visit so patients can fill them out from the comfort of their home and easily check health insurance info and prescription drug info. Then, once the patient checks in at your office, you can send another link where they can screen for COVID-19 and describe their symptoms. You can also utilize Jotform's HIPAA-compliant forms to make sure your practice is doing its privacy due diligence. Implementing user-friendly mobile forms will not only expedite your screening process, but it'll boost your patient care as well. Let's do a quick review. There are a variety of patient screening methods you can use. There are paper forms, phone screenings, and electronic check-ins. While all of these are good options, they can result in errors. For the highest level of patient care, try implementing online forms. Patients can fill them out at home prior to visits, where they can check insurance and prescription drug doses. They can also fill out patient screening forms while sitting in your waiting room, cutting back on the potential spread of illness as well as nipping clerical errors in the bud, all resulting in the utmost level of patient care possible. I'm Alex with Jotform. Thanks for watching, and we'll see you again soon.